Your cat is drinking from the toilet? This isn't a funny habit. It could be a sign of diabetes or kidney failure. And there are 9 hidden signals like this. Today I'll tell you about the ones you're definitely missing. Hey everyone, today we're going to cover 9 non-obvious signs that your cat needs a vet. Right now. Even experienced cat owners miss these signals, yet they're the ones that help catch disease in its early stages. By the end of this video, you'll know what to watch for every day to save your pet from serious complications. If this matters to you, hit that like button so the algorithm shows this video to other cat owners. Let's go. First signal, changes in sleep patterns. Most owners think, well, she slept in a different spot, no big deal. Or they blame it on heat, cold, or mood. But here's what's important. Cats are natural conspirators. In the wild, showing weakness is deadly dangerous. Predators specifically choose sick prey. That's why your domestic cat instinctively hides pain and discomfort. And sleep is the first thing that changes. If your cat suddenly starts seeking cool places, bathroom tiles, windowsills, or the opposite, hides in the warmest corner, sleeps restlessly, wakes up frequently, meows or moans in their sleep, twitches their paws, jerks awake, this could be inflammation, elevated temperature, neurological problems, or a pain response. Monitor where and how your cat sleeps. A change in resting location isn't a whim. It's an alarm signal, especially in cats over 7 years old. Second sign, declining playfulness. She just grew up, she's tired? That's just her personality, that's what owners typically think. But playfulness is a barometer of a cat's health. A healthy animal regularly explores territory, responds to toys, and engages with humans. If your pet ignores favorite toys, stopped chasing that crinkly wrapper or laser pointer, prefers to just lie around, doesn't respond to invitations to play, the cause could be hidden pain, arthritis, dental problems, chronic fatigue, systemic disease. And you know what's most insidious. Your cat won't limp or whimper, she'll just move less. Keep an activity journal. How many minutes a day does your cat play? If that number drops for several days in a row, that's a reason to visit the clinic. Third signal, changes in drinking habits. Owners rarely track how much their cat drinks. Well, she drinks, what's the difference? But this is a key indicator. If your cat started drinking less, it could be mouth pain, stomatitis, gingivitis, tooth abscess, fever, body intoxication. Sometimes the reason is simple, a dirty or inconveniently placed water bowl. But there's also the opposite situation. Your cat drinks too much, constantly empty water bowl, goes to the faucet, tries to drink from the toilet. Excessive thirst is a classic symptom of diabetes mellitus, chronic kidney disease, hyperthyroidism, in unspayed females, pyometra, a purulent uterine infection, liver and adrenal gland pathologies. And here's what's critical. These diseases kill slowly, but if you catch them early, they're treatable. Set a weekly reminder to check. How many bowls of water does your cat drink per day? If the norm has changed, go to the vet immediately, especially if your cat is over 8 years old. Fourth sign, neglecting grooming. Just being lazy, getting old. Doesn't have time. No. Cats always have time to groom themselves if they're healthy. Shiny, clean fur isn't just beauty. It's a health marker. If your cat stopped grooming, fur became dull and matted. Mats appeared. Cat grooms some body parts but avoids a specific area. This can indicate dental problems, painful to open mouth, arthritis, can't reach back or tail, general malaise, depression, pain. By the way, if your cat grooms excessively to the point of bald patches, that's also a warning sign. Stress, allergies, parasites. Once a week, run your hand through the fur against the grain. Clean, smooth, no mats? Great. If not, this isn't laziness, it's a symptom. Fifth signal, barely noticeable changes in movement. She got old, she's clumsy, she didn't want to. Owners attribute this to personality or age. But think about it, why did a cat who jumped onto the windowsill for years suddenly stop? Why did she become hesitant climbing stairs? Why does she walk around obstacles instead of jumping over them? Causes, arthritis, joint inflammation, spinal injury, limb pain that the cat is hiding. Cats don't complain, they just adapt. And you might not notice for years that your pet is in pain when moving. Watch the jumping. If your cat started jumping less frequently, lower, or stopped altogether, this isn't old age, this is pain. Show her to a vet, get x-rays of the joints. Sixth sign, rapid breathing without reason. Many think, just hot, got stressed. But if your cat is lying calmly, hasn't played, hasn't run, room temperature is normal, but breathing is rapid and shallow, this is an emergency signal. Heart problems, vascular disorders, respiratory system diseases, anemia, fluid in the lungs, asthma. Know what's scariest? These conditions develop quickly, and if you miss the moment, you could lose your cat in a few hours. Observe your cat when she's sleeping or lying calmly. Count breaths per minute. Normal is 20 to 30 breaths. If more than 40, that's reason for an immediate clinic visit. Seventh signal, indifference to food. Owners notice complete food refusal, but they miss a more subtle sign. The cat eats, but without interest. If your cat approaches the bowl hesitantly, eats slower than usual, leaves food behind when she used to finish everything, smells food but doesn't eat. This could be tooth or gum pain, gastrointestinal diseases, gastritis, pancreatitis, general weakness, onset of illness. And it's important to understand, cats don't get picky with food for no reason. If appetite changed, something's wrong with the body. Monitor not just whether the food is eaten, but how your cat eats. If the process changed, schedule an examination. Check teeth, run blood tests. Eighth sign, litter box oddities. Owners clean the litter box on autopilot. Don't pay attention to details. But your cat's litter box is the most important diagnostic tool. Warning signs, blood and urine. Even a drop. Urine of strange color, dark, cloudy, with sharp smell. Cat goes to the box too frequently in small amounts. Or the opposite, not too rarely, but very large amounts. Cat cries when urinating. Squats in the box, but nothing happens. These are signs of cystitis, urinary stones, infections, kidney failure, diabetes. And here's what's critical. If your cat can't urinate for more than 12 hours, it's life-threatening. We're talking hours. Every time you clean the litter box, look at the contents. Color, amount, smell. Any deviation, call the vet. Don't wait thinking maybe it'll pass. Ninth sign, personality changes. She's offended. Bad mood, age. Owners humanize their pet. But cats don't act up. If an affectionate cat became aggressive, a social one hides, a calm one gets nervous, this isn't a mood, it's a cry for help. Alarming changes. Cat avoids contact, hides, hisses when touched, stopped greeting at the door, became aggressive without reason, or the opposite, too clingy, won't leave your side. All this can be a sign of physical pain or psychological suffering caused by illness. Any persistent behavioral change lasting more than 2 to 3 days, that's a reason to show your cat to a vet, even if there are no other symptoms. So, let's summarize. All 9 signs aren't isolated incidents. It's a system. Cats instinctively hide pain and weakness, and our job is to pay attention to the details. Changes in sleep, play, drinking, appearance, movement, breathing, appetite, litter box habits, personality. These are all pieces of one picture. And the sooner you see that picture, the better chance you have to save your pet's health and life. Now, a question for you. Which of these 9 signs have you noticed in your cat? Write in the comments. This is really important because your experience can help other owners. And if you found this helpful, hit that like button, subscribe to the channel. In the next video, we'll cover how to properly choose a veterinary clinic and what tests your cat needs annually. Take care of your pets. See you.